yesterday, the World Health Organization announced an international fund that allows institutions and private individuals all over the world to contribute to global response efforts. Bruce Alward is the organization's Assistant Director General, and he joins us by Skype from Geneva. Hi there. Thank you very much for making time for us. Really appreciate it.
Good evening.
Can I start off by asking you just a more general question, sir, about the state of the virus right now? I note that the 5,000 mark was hit, but also that the pronouncement was made that the epicenter has moved away from China. How do you interpret that, or how should we rather interpret that?
Well, what we're seeing is the inexorable march of this country of this virus across the planet. And, you know, as we saw from when this first spread out of Wuhan and right across China very quickly, 23 days to infect all of the provinces, it was clear that this was going to continue to move. So I think what we saw in Asia is now being replicated in Europe, and there's no reason we should not see it continue to move unless there's some very, very strong control measures in place to try and contain the virus and take some of the heat out of the outbreaks.
So, Dr. Alward, when you talk about strong containment measures, what specifically are you referring to?
Well, the bottom line is that you have to test to know all of the suspected cases. Your population has to know what the disease is. They have to be able to be accessed and tested very, very quickly. And then if they're positive, you have to have an effective way to isolate them and identify their closest contacts and quarantine them. This virus can only survive in humans. It has to get from one to another. So the goal is to find it fast, break the transmission chains. That's how China turned this around, and some of the other countries that are doing it are doing the same.
And when it comes to testing, what is important? Is it the speed of it? Is it the number of them available? There's lots of questions here right now. There are sort of centers being set up outside of hospital settings so that you can either go directly there because the waits on telehealth, for example, are so long. Like, what should the ideal testing scenario look like?
Yeah, there's not an ideal number. The number is enough to be able to make sure you can test all of your suspected cases rapidly. There's no point just testing everybody for this virus because it makes itself manifest in the illness in people. So you really want to just have enough tests available for that purpose. And you want to test people fast. Remember, as long as people are wandering around sick, they're spreading the virus. New transmission chains are starting, and more people are going to get sick and more people will die. So the goal is to find the virus as quickly as possible, the sick people. That means making sure the population know what the disease is, know how they can get tested, get a rapid test, and then someone act on that test very quickly.
I want to ask you a couple questions, Doctor, about the Canadian context. First, something a lot of Canadians are talking about today is certainly that the Prime Minister is in isolation for the next 2 weeks. He says as a precaution because his wife, of course, has been received a positive test.
Actually.
Quarantine, I'm sorry, yes, thank you. I think they've used the word interchangeably, but yes, quarantine. Can you explain?
No, they're not interchangeable.
Well,
right.
Well, I've heard both from this. Tell me what the difference is, if you don't mind, then.
Yeah, so you isolate your cases. Yeah, I'm sorry to jump in there, Vassie, but you isolate your cases so that they won't come in contact with anyone else, won't spread the virus. With the because they're infected and you know they have the virus. With your contacts, you quarantine those because they're under observation to see if they actually have the virus. Because what we saw in China was about 5 to 10% of these close contacts actually developed into cases. So you really want to keep a close eye on them. But that's a different phenomena than isolating, treating, managing the cases.
Gotcha. So in the Prime Minister's case, then, he says that he's not getting a test on the advice of medical professionals because he's not showing symptoms. Can you explain a bit about the symptomatic portion of this? Because I think a number of people are sort of confused. Can I have it if I'm not showing symptoms? Can I transmit it if I am showing symptoms? That kind of thing.
Yeah, it sounds like the Prime Minister could explain it just as well as I can, because he's right. What happens with a disease like this is you get infected, and then you have what's called an incubation period. That's the period in which the virus is, let's say, taking hold in your body. And then you become infectious. Now, in this disease, you become infectious, meaning you can pass it on to somebody else a very short time before you actually develop symptoms. Usually, it may even be the same day that you develop symptoms, the day before maybe, but not much before. And then while you're sick with the disease, you can also, you'll be what we call shedding the virus, and you're still infectious. Other people can get it for you. So the trick is to find people as quickly as possible once they become sick, and then try to get them isolated, as we talked about. And in the case of the Prime Minister, what he was explaining was, I may or may not be incubating the virus, but at this point, we don't know. And if you do a test, it'll probably be negative and give me a false sense of security. So only if I start to develop symptoms. But even because, however, the Prime Minister recognizes he could be infectious even before he develops symptoms, because of that, he's playing it safe and he's in quarantine and being a good citizen, frankly.
I have less than a minute left, Dr. Alward, but I'm wondering where containment measures are concerned. Some extra restrictive measures were announced today here, particularly where international travelers are concerned. What is your advice where travel is concerned and where the border is as well?
Well, as WHO, we don't recommend any restrictions on trade and travel because, as you've seen in Canada, the virus gets into the country anyway. The key thing is be able to find it very, very quickly, contain the cases like we talked about or isolate them, and then quarantine the contacts. So generally, frankly, the travel restrictions don't work. They become a big distraction. They cause all sorts of other problems.
Okay, I'm going to leave it there. Thank you, Dr. Alward. I really appreciate you making some time for us this afternoon.
You're very welcome.
That's Dr. Bruce Alward, Assistant Director General of the World Health Organization in Geneva. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.